In our last video for microbial growth this week, I wanted to talk about biofilms. Now, I know we mentioned biofilms earlier in the semester. We were talking about how microorganisms some of them can surround themselves with these sticky layers. Remember we said there was a glycocalyx, kind of a sugar coat, and one of these kinds of sugar coats was a capsule and the other one was a biofilm. The biofilm is kind of this sugary carbohydrate sticky stuff that the bacteria surround themselves in. And one of the things that they can do is it allows them to attach to surfaces. And remember, we were talking about how bacteria or microorganisms in mixed communities attach to a surface. They're called a biofilm. And you might remember, like I probably said when I go to change my dog's water bowl, I can always see this kind of cloudy, slimy stuff that even after a day or two, it gets kind of cloudy, and you could like run your finger down it on the surface of the bowl and see that there's stuff growing there. So whenever I change the water, I always wash it out before I put new water in there. And that's a biofilm. Or we talked about how on our teeth, that the roughness, the plaque, what are we brushing off with our toothbrush? We're trying to scrub off biofilms. And I just wanted to kind of talk about biofilms a little bit more and the importance of them clinically. So first I want to just talk about how they form. Before I go any further, biofilms are probably the more common way you'll find microorganisms in nature. So like in your mouth, like I say, they're attached to your teeth. There's some in your saliva, but given a chance, leave it there long enough, they'll also attach to your teeth. So microorganisms attaching to surfaces is really a common way for them to grow in nature. So plankton are floating microbes. So you've got floating microbes, and they're eventually going to find a surface and they're going to attach to the surface. So they're showing you that there. And so some of these have slime layers that help them attach to surfaces. They might have other things. But, and so that as soon as I put water in my dog's bowl, the water's not sterile. There's microbes in there. And I put it in the bowl and it says within seconds, some of these microbes are going to start attaching to the inside of the bowl. Some of the first ones to attach are going to become irreversibly attached in seconds to minutes. So they're going to stick there pretty tightly. And then they're going to start growing. So they're going to divide. Now, there can be all sorts of different microorganisms in these biofilms. It doesn't just have to be one kind. And so here they're showing you they're making extracellular polysaccharide. They're making those slime layers. And the slime layers are going to help them attach. They're going to help them attach to each other. But also, they have kind of spaces in them. So water can move through, delivering nutrients, taking away wastes. And then finally, what happens over time, days to months, that attachment of those microbes is well established, and pieces of it can break off and float away and go attached to another surface. So these biofilms become more and more complex as the longer they're there. Think about with our teeth. We start off with the biofilm. If you get to those little nooks and crannies in your teeth that you can't scrub off very well, or you don't scrub off very well, over time, they're going to stick to your teeth even more strongly and eventually make plaque. I mean, they're going to get hardened onto your teeth. So these biofilms can be a big part of a surface. They can be very common on that surface or cover most of a surface. I wanted to just show you a little bit about some of the importance of biofilms. And there's a statistic here. It says it's estimated that 70% of bacterial infections involve biofilms. And this is something that is a relatively new understanding of how microbes cause disease. We think about them, they're in our blood, they're, circulating around, they're in the urine or wherever. But they're not, they're much more likely to be attached to a surface than to be in just floating around, being planktonic. Remember that these biofilms have a mixture of microorganisms. They're not just one kind. So these mixtures of microorganisms, they're sheltered from the immune system. If I go back and I look at the picture right here, I mean, there's bacteria that are way buried inside of this biofilm. So when your antibodies or your T cells come to try to remove these microorganisms, a lot of them are hidden from the immune system. So biofilms can shelter bacteria from the immune system, and this can be really critical in infections. Bacteria in biofilms are 1,000 times more resistant to antibiotic drugs than those not in biofilms. So again, because you've got bacteria that are buried in here, if you treat it with a drug, the ones that are deep inside aren't going to get exposure to that antibiotic drug, and they're going to be harder to eliminate. So bacteria in biofilms are 1,000 times more resistant to antibiotics than those not in biofilms. Think about like an ear infection. If you know anything about the anatomy of the ear, those middle ear infections that a lot of little kids get, they're in that space where you have the three little bones, the malleus, incus, and stapes. And so all the surface of those bones, the surface of the inside of the eardrum, and all those surfaces can have bacteria growing on them. So you can get biofilms in that middle ear. I wanted to show you this. Just this one right here says Pseudomonas biofilms. Pseudomonas is a certain kind of bacteria. It's really common, causes a lot of different kinds of infections. Pseudomonas biofilms in the lungs are the leading cause of death in cystic fibrosis patients. You might know about cystic fibrosis is the most common fatal genetic disease in the U.S. And what happens with people with cystic fibrosis, if this is one of the little air sacs in the lungs, an alveolus, they accumulate mucus in there. And that's a great place for bacteria to grow. And the bacteria grow in that mucus and they make biofilms and they stick to the surface. And it's much harder to get rid of them. The alveoli, these air sacs in the lungs should be free of bacteria. So it's hard for the immune system to clear them out. So Pseudomonas can be a serious cause of death a big cause of death for cystic fibrosis patients. I thought this was kind of interesting. What this picture's showing you, there's some details here you don't need to know, like about what kind of, so these are 4 different kinds of microorganisms. And here's a picture of them growing on some kind of surface. So 4 different kinds of microorganisms growing on a surface. These are some really nice transmission electron microscope pictures that you can see these biofilms that were created. Actually, this is a different kind of microscope than a TEM. It's a little bit more sophisticated than that, but it's allowed us to see biofilms really well. So what they did here is they took this same solid surface and they treated it with something. It's, I don't know, poly something. They gave it the name poly. And what they showed you is, that treatment really reduced the amount of biofilms. You can imagine somebody getting an implant, like a hip replacement, that's got surfaces. You've got to absolutely keep the bacteria off that, keep it completely sterile, or bacteria can start colonizing the surface and make biofilms and be more resistant to antibiotics. So a lot of the implants have different surfaces that prevent biofilms. They took this surface and they added some copper to it. And look at that. They dramatically reduced the amount of biofilm. So there's a lot of technology about how do we create surfaces to prevent the formation of biofilms. It's a really big deal. Anyway, I'm going to stop right there and we'll talk a little bit more about microbial growth in the next week's topic. Take care.